Well, can I just ask about actual implants body? I understood there are implants which are made out of two parts, abutment and the other bit.
No, they one part
No,
implant.
ours, that's ours.
Okay.
And then there is one which is unified, the unit, which is all together.
So he's asking about
manufactured.
one-piece and two-piece implants.
What implants do we use?
Yes, and why is
And why?
Is it better and why is better?
Okay. All implants, most of the implants are made of titanium.
Yeah.
There are some implants, a small amount of implants, they are made of zirconium. Okay, so there are two biomaterials, two metals. They are biocompatible, which means that our body does not reject them immediately. If you have an implant made of stainless steel or, I don't know, silver or something, it will come out with pus sooner or later. Okay, so those biomaterials, titanium, your body almost doesn't see it.
Yes, that's about right.
So it basically doesn't reject it, okay? Our implants are made of titanium. It's great for titanium, so it's pure titanium. They are one-piece implants, which basically means that the part which is inside the jawbone and the part which is connecting to the prosthetics are one piece. So I used to work with a two-piece solution for many, many years. When you have an implant itself which is sitting in the jawbone, okay, underneath the gum, and then you have another piece which is called an abutment, and it's screw with another screw, okay? So you have this mechanical connection in between them, okay? And you have another screw in a screw in a screw, okay? So eliminating this with help us to eliminate problems like screw loosening and marginal bone loss, because if you chew all the time, if you have the movement, okay, the screw, more screws, they might loosen, and the movement, micro movement on the bone level cause the bone to reduce, the bone to shrink. Okay, so using a one-piece implant allowed us to eliminate this problem.
Yeah.
So in dentistry speak, you will hear people talking about bone level implants and tissue level implants. Two-piece implants, which are primarily bone level, and one-piece implants, which are primarily tissue level. The reason I like tissue level is because we're very far away from the bone in relative terms. So if the gum tissue is 2 millimeters thick, then where the rough titanium engages with the bone, there is no connection there to come loose. Because if that connection ever came loose, you wouldn't even be able to feel it, and it could go on for months and months and months and nobody would have a clue. You start getting this pump action happening. It's called micro movement, and the fluids go in and out, in and out. The mouth is an incredibly contaminated environment. And if you start having that happening, then you can get something called marginal bone loss. Marginal bone loss is where the bone starts shrinking away from this movement area because it doesn't like these fluids. So the bone just goes away. But then remember, the bone is also holding the implant. We don't want it to go away. We want it to stay up to the implant. So by using the implant that we use, which is a one-piece, we're eliminating a connection below the gum line that we can't see. Now, if the screw goes loose at gum level, you'll know about it. Because you'll say things like, when I flick it with my tongue, it moves. Right, well, we'll see you tomorrow. Do you know what I mean? You'll know immediately. But if you have two screws, so the one that's connecting to your implant, the one that's connecting the abutment to the implant, that goes loose, but this other one feels tight, then your teeth won't move, but the thing underneath is moving. And we won't know until we see you for annual maintenance. So if it happened a week after we saw you and we don't see you for another 51 weeks, we've got a problem.
Yeah.
So here we made a conscious decision to work with a one-piece implant so we could eliminate the screw we couldn't see and just work with the one we can see and service like that. It's so easy to just, as opposed to taking everything. We don't need to, we just need to tighten it. That's it, done, bye. And it all goes back to how simple can we make it for you and your biology to deal with on a day-to-day basis. Because let's face facts, who is actually concentrating when they're chewing? No one. We just shove stuff in and then we get on with the conversation. No one's oh, I think the abutment on the lower right 4 is loose. Yeah, no one does that. So we have to almost engineer in or think about, how can we make this simpler for you? How can we make it much, much, much easier for you to manage? And have we got fail-safes in place that you'll know immediately?